Welcome all to this special webinar event in collaboration with Fairhaven Health and Fullscript/Emerson Ecologics. I'm Amy Regan from Fullscript, and I'm so glad that you joined us today. A few housekeeping notes. Please place all questions you have in the Q&A box for a chance for them to be answered during the Q&A section. This webinar is being recorded, and the recording will be sent via email to all attendees and registrants, and there's a copy of the presentation in the handout section. It is my pleasure to introduce Donna Kent, Sales Director at Blue Ruth Health. Donna Kent, who is not just your average sales professional, sees a catalyst for growth, a passionate advocate for all things nutrition. Armed with a BS in nutritional science, Donna is not just about crunching numbers. She's dedicated to nurturing health, both in business strategies and on dinner plates. At Fairhaven Health, she offers you 18 years of successful leadership in the healthcare industry, specializing in partnering with healthcare practitioners to optimize patient care and practice revenue. She is adept in nurturing client relationships and delivering tailored solutions with a proven track record of enhancing healthcare practitioner practices through strategic nutrition education and supplement solutions. Donna, welcome.
Hi, everybody. Thank you for joining us today. I'm excited to introduce our presenters. First, we have John P. Troop, PhD. He's the Chief Science and Education Officer here at Fairhaven Health. As a leading industry expert with more than 25 years of successful category and clinical nutrition experience, Dr. Troop provides key insights on the innovation, selection, and use of Fairhaven Health products and advances educational insights to help practitioners and consumers select products to support healthy lifestyles. Throughout his career, Dr. Troop has led educational and clinical research initiatives that advance the important role of nutrition in healthcare and dietary supplements. He's also been active in advancing and growing the dietary supplement industry and has been a consulting expert preparing new legislation and regulations for modernization of DASHA. Dr. Troop is a married father of 2 grown daughters, and outside of the workplace, he enjoys travel, cooking, and fitness activities. And Professor Ashok Agarwal is the founder and director of the Global Andrology Forum in Cleveland from 2020 to present. He served as a high complexity clinical lab director, emeritus staff at the Cleveland Clinic Foundation. He's been the director of the Andrology Lab and Reproductive Tissue Bank at the Cleveland Clinic Foundation. He's the director of research and training for the American Center for Reproductive Medicine in Cleveland. Also a professor of surgery and urology at Case Western University, has been director of research and the assistant professor of urology at Harvard Medical School, has trained over 1,000 scientists, clinicians, graduate, and undergrads, and has given live and virtual talks attended by over 10,000 reproductive professionals from the United States in more than 130 countries. He is the recipient of the IVF Expert of the Year for 2019 by the American College of Embryology for significant contributions to human reproductive embryology, is ranked as the #1 author in the world in the fields of male infertility, andrology, and human-assisted reproduction based on 905 peer-reviewed publications, is a Google Scholar, and has been the editor of 50 medical textbooks and manuals and 15 special journal issues related to male infertility, ART, fertility preservation, DNA damage, and antioxidants. Please welcome our esteemed presenters and enjoy the presentation.
Great, thanks. Thanks, Donna.
Thank you very much.
And thanks, everybody, for giving us the privilege of your time today. We're excited to share with you some insights on fertility and some recent data and publications that Dr. Agarwal will share with us. We have a lot to cover in the 55 minutes or so that we now have available to us. We look at the fertility as a continuum in life, and actually it's not just about the ability to conceive, but also to make sure that the baby is put on the most positive health trajectory as possible. So it's a multi-generational impact that takes place and that has an underlying systems approach to it. Fertility or infertility, we would consider it to be really more a symptomatic issue rather than anything else, and that's affected by the underlying systems. And today we're going to focus on a big part of what those underlying systems are as the major stressors that may get in the way of conception and also has the possibility of compromising the health trajectory of the baby and the mother. So today, what we want to do is highlight a little bit of the issues and the underlying causes of what leads to infertility in both men and women. We'll talk about the underlying systems of external influencers and exposures that have an effect on functional physiological changes along with metabolic changes. And we'll talk about reproductive success and what it has influenced it, and by the at-risk stages in the reproductive cycle that are important to be aware of in trying to manage fertility overall with this broad definition that we proposed. What's interesting is the influence of environmental stressors is quite important, and as probably we all know in this phone call, the impact of an epigenetic influence makes it multi-generational in awareness. The good news is that from a genetics point of view, it doesn't define our destiny, and knowing this will help us be able to do a better job of using nutrition therapies to manage it. So during the course of today's presentation, we want to go through a little bit of a highlight and overview of what is reproductive success, talk a little bit about the stresses of fertility in the reproductive cycle and the windows of vulnerability, both in the ability to conceive and in the ability to maintain a healthy trajectory for the baby and mother as possible. We'll talk about recent and new data coming from epidemiological studies defining the environmental stressors and exposures. And then I'll turn it over to Dr. Agarwal to talk really about the role of oxidation in ways to manage the issues that we would have led up to. At the end, we'll talk a little bit about very specific clinical protocols and very specific nutritional solutions that can be used to address these underlying issues in your patients. So fertility is a continuum, and it ranges from really sterility to hyperfertility, and we know that it has a number of key influencers in life. And basically, we would boil down to and define three major buckets of influences. There's the genetic predisposition that determines reproductive health, and this is multi-generational. There's the healthy and viability of both sperm, egg, and embryo, and making sure not only is it viable in its own right, but also viable in coming together and creating the embryo. And then all of the features of the embryo that will be influenced to determine the health trajectory of the baby. And that's why the third point is so important, is fertility includes an understanding and recognition of health trajectory management at the same time of being able and capable of being fertile to produce a baby. So reproductive health and fertility continuum involves a number of key issues. We've already briefly mentioned the genetic disposition, the important role of nutritional balance and support, and the role of essential nutrients in being able to manage a healthy reproductive cycle and lifespan. Life cycle stressors that can get in the way of those issues and make fertility a little bit more complicated, conception taking a little bit longer potentially. And mounting evidence now of environmental exposures and stressors as well that can also be managed. Reproductive functionality will be determined by these underlying systems of influence, but also we now know and will demonstrate that we can be able to manage this with good nutritional and natural support. We also know that there are medically treatable conditions and surgically correctable conditions and other confounding events like chemical exposures through radiotherapy and chemotherapy, but we're going to be spending our time really talking about the top 4 or 5 key issues for the balance of this discussion. Now, when we define fertility, we look at it as part of the perinatal events, and it starts at the very early stages of when couples begin planning. We now know in talking to a large number of patients that as soon as a couple decides that it's time to start planning for a baby, they start taking nutrition and healthy lifestyles even more seriously, and that's a good thing. We now know that 60% of couples planning to get pregnant are already taking a multivitamin or a prenatal, and that's probably the most important first step to consider. After that, it really is about let's try to make a baby, and for the most part, and I'll share some statistics in a little bit, the first 6 months, and where fertility becomes an issue where people start thinking, maybe this isn't as easy as I thought, happens right around 6 and for sure the 12-month window of trying to conceive, where that becomes a problem. we've been able to identify some of the critical issues that hinder the ability to conceive, and we'll talk about that. But the way we look at fertility overall in the perinatal stage is really looking at these four major segments in the fertility process. Now, infertility, as I mentioned, is not a disease, but a symptom. 1 in 6 couples are affected by infertility, which really means longer than 6 months and typically longer than 12 months to conceive. The monthly probability of conception by age is shown in this slide. And here you can see that by age, the percent pregnancy per cycle really decreases with age. So age may be one of the first steps to simply be aware of having an effect on the ability to conceive. The monthly probability of conception by age in women versus men is illustrated in this slide. And you can see there's an age effect that happens sooner in women than men. And the relative fertility rate falls really at about a threshold of 35, a little bit even before that for women, and slightly later for males. The cumulative probability of pregnancy in couples based off of the months of trying are shown in this slide. And we can see here that roughly 38% of couples will become pregnant in their first month of trying. But by the third month of trying to conceive, that number jumps anywhere from 45 to 60% as a probability of successful conception. And by 6 months, on average, is about 80% as a cumulative pregnancy rate. So overall, the statistics show favorability in becoming pregnant, and it's the 15% of couples that will spend a little bit more time in general for conception, but 100% of everybody that will be talking about the role of nutrition in being able to influence the health trajectory of the baby. Pregnancy loss and impaired fertility is also an issue. We know that up to about 6 million couples are pregnant during the course of the year, but yet there are only about 4 million plus or minus births during the course of the year. And some of these losses amount to about 30% or so due to either biochemical or clinical pregnancy losses and awareness. Unexplained infertility still remains an issue in about 30% of those cases of infertile couples. And a lot of that can be identified for the most part with diagnostic screening. Age plays a role. And then there are undetectable reproductive disturbances or undiagnosed diseases that are also important, particularly when it comes to understanding the metabolic and the endocrine influences, and frankly, the stressors of life that can really influence the ability to remain fertile and conceive. And so during the balance of this discussion, we'll be highlighting and talking about exactly what those are and what can be done to manage that. Fertility and pregnancy of loss by age is illustrated in this slide. We know that it has been a growing issue over the years, but maximum fertility remains the same and really unchanged, though the miscarriage rate in percent increases with aging as well. And a lot of that can be considered as unknown causes or even metabolic and endocrine changes that are important to be aware of. The percent of women seeking fertility services by age is shown here. And clearly, I think everybody would recognize that from 35 years to and older to about 45, for those couples that are experiencing a longer time to conceive, they are actively seeking. And fortunately, there are services now that can help facilitate fertility. We believe that there's a big opportunity to more completely leverage the opportunity of nutritional therapy in being able to manage this symptomatic response. Let's move on and talk a little bit, having understood now some of these statistics and the size of the problem and challenge, and talk about what defines reproductive success. We know that there are really 3 major issues that will influence on a weighted basis the ability to successfully conceive, and that includes the environment and the environmental stressors, genetics, the genetics predispositions that is really typically generations old, at least 2 generations of influence, and then ultimately behavior, lifestyle, and choices. And for the most part, genetics can make up somewhere around 30% of the influence on the issue of maintaining fertility. And the environment and behavioral lifestyle choices actually have a weighted impact of right around 40 to even as high as 50%, depending on where you live and what lifestyle you choose. The good news is that understanding that allows us to be able to better and more effectively manage that status. The female causes of infertility, as I just mentioned, include genetic, lifestyle, particularly diet and nutrition, as we'll learn more about. The origin can be either because of a genetic predisposition or adult exposure, and then that will involve dysfunction of ovulation, tubal factors, endometriosis, uterine abnormalities, and other underlying pathologies that have been noted. In terms of paternal factors, there's a huge awareness now of the impact of environmental stressors on the male and the male sperm. Environmental exposures and epigenetic alterations are transmitted to the sperm. Sperm carries a significant amount of chromosomes, obviously DNA, and so the methylated DNA and non-coding RNA and proteins can be affected by the environmental exposure, but can also be influenced by good positive nutrition. And so sperm, and the reason why it appears to be that the issues related to infertility may have a 1 to 5% increase risk related to the male is really because of the greater susceptibility that the sperm may have to environmental and other lifestyle stressors. The causes of infertility, again, are the same, and it's, again, a generational issue or an exposure problem. And the typical semen parameters abnormalities include having low to no sperm count at all in the semen, endocrine disturbances, especially the HPA and HPG-axis we'll talk more about, testicular failure, ejaculatory dysfunction, and genitourinary infections as well. It's been interesting to note that from 1973 to 2018, the total sperm count has declined 60%. And a lot of this has been hypothesized to be due to the increasing environmental stressors, the increasing lifestyles of stress that we all experience is having a major and a quick impact on sperm count. And so the good news is while these trends are growing in concern in the numbers, we now have both good clinical data and clinical insights to identify pathways in the future of using nutrition to be able to better manage and minimize the symptomatic problem. Let's move quickly now to the stresses of fertility in the reproductive cycle and talk about where and how they are influencing not only the ability to conceive, but also the impact that it may have on the health of the baby and the mother. The reproductive cycle is well known. I think we all know it from fertilization, and it basically is a cycle of life. We know that every one of these steps and every phases can be influenced by nutrition and environmental pressures, and they all have an impact on the ability to conceive, and more importantly, on the ability to have a baby with a positive health trajectory. The environmental and lifestyle stressors can have an impact on key stages of the fertility continuum, and this includes in the preconception phase, periconception phase, basically the health of the sperm and the egg and the viability of the embryo, the development of the embryo, and then the postnatal period of infant growth and adaptation to the world, if you will, and then ultimately in childhood. And all of these have both a genetic component to it as well as an environmental and nutrient influence as well. So understanding where these influences can happen will make implementation of nutrition more effective. One of the probably less appreciated issues that we have identified and that patients and consumers and couples are now better understanding is the stress response. People will talk about the HPA-axis with quite a good deal of available science and clinical insight, but less is talked about the link that the HPA-axis has on the HPG-axis. And so this link is really quite critical in understanding how cortisol can be balanced, and the role that cortisol balance has in maintaining healthy reproductive hormone responses is quite important. So while the HPA-axis is really a core and a center of a neuroendocrine communication network, basically causing the release of cortisol, responding to stressful situations, the increase of cortisol also has inhibitory actions on the gonadotropin releasing hormones. It has inhibitory actions on follicle stimulating and luteinizing hormones, as well as on the fundamental health and functional capacity of the ovaries. And so all of these influences in this network of underlying systems is really critical. And as it turns out, it's playing a greater and more significant role than it ever has, particularly because of lifestyle exposures and also with the mounting evidence now of environmental exposures and stressors as well. So when it comes to anxiety and managing the stress response, it boils down to the significant and central role that the HPA-axis and cortisol balance plays on being able to manage more effectively and completely the reproductive hormones. And so you can see that this network of HPA and HGA-axis are really critical, and it's influenced by these environmental stressors, ecological stressors, emotional stressors, and physical stressors. And that basically all of the endocrine responses that are listed here below each graphic are really critical. And the good news is that they can be minimized and more effectively kept in a normal response with basically a clinical nutrition approach. The embryo and fetal development should also be concerned. As it turns out, many of the same nutrients that impact and influence the viability and the health of the sperm and the egg also influence the health trajectory and the genetic profile or wherewithal, if you will, of the embryo and the developing baby. What's important to realize is that nutrition can be linked to very specific phases in the development of the baby, as well as it can be clearly linked to the viability and the health of the sperm and the egg themselves in general. So it's important to consider when you're managing the readiness to be able to conceive that sperm health and egg health and ultimately embryo health is really influenced early on before conception. And so that planning phase of when couples are thinking about it has a significant impact from nutrition as well. Now, fertility and the health potential of a healthy baby really begins in utero and at the very first or pre-generation. So if you think about, your grandmother is really generation O, and then the mother then and the genetic predisposition influences the profile and the health trajectory of the baby. And then ultimately, even as the reproductive system is being developed in the developing baby, all of that is going to be influenced by a series of environmental stressors, lifestyle stressors, and the nutritional impact that the baby will be exposed to both in utero and then early in the first total of 1,000 days of complete life. And so all of that can be reduced into looking at the very specific phases of preconception, conception, and the early phases of development. And each of these can be linked into the major morphological development phases, and then linked to the very specific nutrients that will have major impacts on the development of any underlying system and response for the baby. And so it's important that when there's both in the planning phase and a concern of fertility, that time be taken, the discussions with the patient, to better understand their familial history, they understand their lifestyle practices and their nutritional practices to make sure that the best nutrition can be put together in a very personalized profile to maximize the health of the baby and obviously to maximize the health of the egg and the sperm for a very viable and healthy embryo. The reproductive cycles and segments of vulnerability will impact reproductive success and health trajectories. And each of these phases have an influence in a generation, particularly having an influence on the genetic predisposition. But knowing this helps us determine what the interventions can be. And again, the preconception and periconception phases that play a big role in determining both the profile of the baby, but more importantly, even the ability to conceive. And then it becomes the prenatal phase, which is really all about the development of the embryo and the baby, and the postnatal phases, and then early growth and development. So stressors in life is really a critical issue. And we can see that some people who can manage stressors better than others, or those people who have greater medical care and coverage and more relaxed, healthy lifestyle, will look really great during the course of their lives and their lifespan. So their health span is also healthy. And that's what we should be aiming for is to work toward a resiliency coupled with good nutrition therapy to help maximize the ability to conceive and to produce healthy babies. I want to continue to emphasize that the impact that the HPA-axis has as a central role on these systems and symptoms of fertility is really important, because stress in and of itself can lead obviously to anxiety and mood disturbances, but in turn it also affects a number of other variables that should be supportive and helpful. And so, for example, sleep disturbances is really another major issue that further confounds the ability to conceive and the ability to produce a baby with a positive health trajectory. And again, cortisol and cortisol balance is at the center of this issue, and being able to manage the cortisol response, as we talked about several slides ago, will help more effectively manage the hormone balance and be able to make sure that the symptom of fertility can more effectively be managed. And so experimental evidence shows that male stress is really significantly impacted and has a greater impact on the male reproductive system than the female system. And we've been able to, with investigators at the Harvard School of Public Health and through epidemiological studies, identify roughly 7 mechanisms related to the stress response that will have an effect on both the ability to conceive and also have an effect on the healthy baby. And for the most part, it starts off with neurochemical alterations or the HPA-axis in the response, and then all the other areas that will influence reproductive health, hormonal or the endocrine response and the metabolic responses that play an important role. What's important to note is being able to get this right and reproductive health right will also be important because it'll have an influence later in life and actually have an impact on menopause. So the more difficult menopause is, and particularly with early menopause, then sometimes the worse the stress response can have. And we also now know from these epidemiological studies that those individuals that may have a more difficult time conceiving may also be more susceptible to a more difficult menopause or even early and premature menopause as well. And ultimately that'll translate into healthy aging and how healthy of an aging process you may experience. So reproductive health is fundamentally much bigger than just the ability to conceive and to have a baby with a health trajectory that's very positive. It also has lifelong consequences and influence across our lives and the next generation from our lives. So sleep disruption is another example. Restorative sleep is really very critical, and whatever can be done to use and there are nutritional solutions to be able to help support restorative sleep to help manage that stress response will all play an important role during the planning and the preparation to conceive, as well as it will throughout the lifespan of the individuals. Again, the HPA-axis is a central influencer that can have a system-wide effect, and this is the reason why we today describe fertility or infertility as a symptom to the underlying systems. And these are the underlying systems that we're focused on today in looking at nutritional protocols and nutritional solutions to help manage each of these cycles and metabolic and hormonal influences on life. Let's move quickly to environmental stressors. There's mounting evidence that actually shows now that phthalate exposure and other air pollution exposures and material exposures really have a negative effect. I think that's not too surprising to most of us, but the mounting evidence specifically related to reproductive health is quite significant today. Phthalates are endocrine disruptors that can decrease testosterone and total sperm count, in addition to promoting morphological changes in sperm, which will obviously affect the health trajectory of the baby. Fertility will be affected, and we know that there are inverse associations with biochemical pregnancy loss and live births, and then also the offspring of the health now, and recent data and publications just really even in the last 6 to 12 months are quite astounding. Beyond phthalates, we know that there are endocrine disrupting chemicals and male reproductive function later in life. Specifically in fetal androgen deficiency, there's low testosterone production that has been measured, blockage of androgen receptor, and mutation of androgen receptors. And all of these will affect the viability of the sperm and the ability to conceive. We also have been able to identify from recent scientific publications very specific chemicals and their potential adverse events, in particular for males, and then the adverse events that it'll have on birth outcomes. These slides are all going to be made available to you all after this presentation, so I won't spend too much time talking about the detail of this slide or this slide. This slide I think you'll find quite useful, that there are very persistent, non-persistent chemicals that couples are now exposed to around the world that have significant effect in compromising reproductive health and the endocrine and metabolic control. So let's move on now to stress and oxidation and the very specific clinical data that Dr. Agarwal has been accumulating over the last several years, demonstrating the role of nutrition and basically in the form of antioxidants can help more effectively manage and address the issue of infertility and fertility in couples. Dr. Agarwal.
Thank you very much, John. Thank you very much to our host, Fullscript and Emerson, and thank you to everyone who's attending this wonderful program. I am so privileged and honored to be here. It is afternoon here in Cleveland, and so I take the baton from John and try to run away with it. He has covered most of the things that are very important with respect to the topic at hand. My job here is to really cover the problems of male fertility with respect to nutritional value of nutraceuticals or antioxidants in patients who are really suffering from male infertility. So before I really explain this slide and discuss this any further, I just wanted to tell you that male fertility is an issue which has been really sidelined for a long, long time. We are in the 21st century. We still don't know the exact causes of male infertility. We don't know what is the number of patients who have problems of male infertility, either locally or nationally or internationally at the world level. The latest data that we have from the World Health Organization suggests that there are over 200 million couples which are having infertility, and taking the paradigm that about half of all causes of infertility are due to the male factor, where rest of them are mostly because of the female factor, and 30% out of these 50 are due to pure male factor, and remaining where we have both male and female factors combined. And in this group of men, the problems can be due to a variety of causes, which John has described. And there are various types of treatment modalities, whether it is surgical, whether it's medical, or whether it is lifestyle. Now, after taking care of all kinds of causes that are there and their treatment, we find that almost 50% of the patient really have no defined causes. And they fall into the category which we call as a idiopathic male infertility. And some of you will think, what is idiopathic? It's really a black bag of everything that we don't know about the problems of infertility. We throw them into this bag called idiopathic. It means that we are not smart enough. And I can tell you that in this group of patients, this is our interest. This was our main goal when I was working at the Cleveland Clinic as of last year. After 30 years, I started my own research group. And we wanted to understand what is the real problem of infertility in these idiopathic causes, because these are the patients who are really suffering from no treatment, no diagnosis, and they are just going from one thing to another. And what we found is that 80% of these patients have a high oxidative stress. They have no female factor. They have no underlying causes such as either any kind of endocrine, anatomical, or genetic problems. So they have nothing else. They have poor semen quality, and they have no female factor, but they have overwhelming high oxidative stress. So this is the group of patients which we call as male oxidative stress infertility. We defined this term. We have coined this term for the first time in the literature. And we are going to talk a lot about this group of patients, which is not a small number of patients. By the way, this constitutes, even at the most conservative level, more than 50 to 75 million men from all over the world, which is a huge number, which is falling into this category, which really are not being helped at this time. And hopefully many of these men could be helped if we can diagnose their problem of oxidative stress. So let's look at this diagram in front of us that you see here. And you see that there are many causes that have been defined and explained by John. But more importantly, things that are now becoming more easier for us to understand or to wrap our head around are epigenetic factors like DNA methylation, histone modification, non-coding RNA dysregulation. All of these can disrupt development of sperm and function, environmental exposure and transgenerational effect. They can further complicate, impacting the sperm quality. Then transgenerational effects are acquired during the various factors, including stress, diet, lifestyle, and they can be transmitted, as John explained, to future generation, which can potentially contribute to poor fertility by perpetuating epigenetic disruption. Then genetic causes of male infertility, they involve chromosomal abnormalities, gene mutation, Y chromosome deletion. These type of changes can affect sperm production, structure, and function, leading to reduced sperm count. Lifestyle and occupational factors, not just because of the pandemic, but with so many different types of stress that we have, obesity, smoking, exposure to toxins, pesticide, heavy metal, they can all impair male fertility. And unhealthy habits affect the sperm production, quality, and function, which leads to reduced sperm count. So there are many things that we need to understand. Next slide, please. So going further, I think if you look at what is it that we can do in these patients, which are defined traditionally as idiopathic male infertility, because none of the medications really work. There are no randomized controlled trial. There are no FDA-approved medications. People are just trying one thing after another. Something works, something not. And it's all empirical. Means we really have nothing, no handle on this. Now, can we try antioxidants? Well, antioxidants, as we know, are molecules that neutralize harmful free radicals in the body, and they can damage the cells and DNA. They donate electrons to stabilize the free radicals, preventing the cellular harm and potentially improving male fertility by safeguarding the sperm quality and DNA integrity. So this is really the key part that I wanted to dwell on it in terms of the antioxidant. Next slide, please. So many people, many physicians and patients are worried that we really don't know much about the antioxidant, whether there are really good scientific evidence behind this. And there are a lot of negative reports, there are a lot of confusion and controversies about the role of nutraceuticals in male fertility, and rightly so, because of so many things that have gone into this type of area. But I wanted to tell you that there is a healthy amount of scientific evidence. There are robust scientific evidence. There is a double-blind randomized controlled trial, which are considered the highest level of scientific evidence. And not only 1, 2, 3, 4, but there are multiple studies which have been conducted and published in reputable journal, which demonstrates that taking good fertility nutraceuticals by patients with male fertility problems can improve their semen quality. It can improve their functional parameters such as reduction in sperm DNA or reduction in oxidative stress, but it can also improve their pregnancy rate of the couples, but also improve the live birth rate. So this is really very good evidence. Next slide. And there are more studies. These are just a snapshot of studies which I picked from the literature. Of course, there are some studies which do not find any kind of improvement. And I think majority of those studies are because there is not a good patient selection that was carried out, and antioxidants are not suitable for any and every patient. And it is important to know that there is a lot of confusion which is there in the literature, which you will see here. And the doctors are really hesitant to recommend antioxidant supplement because they say there isn't enough research. But I believe that is not true. People just have to look at the literature, look at the right type of literature, and they will find there is plenty of good evidence out there. Next slide, which seem to indicate that there is good evidence in terms of support of antioxidants for male fertility improvement. Now, next slide. If you look at the confusion, it is because there is a diametrically opposite findings and conclusion in these studies, and regardless of negative article, there is an urgent need to provide a balanced picture to the worldwide community of reproductive professionals who are involved in the care of patients with male infertility, especially those who are really considering antioxidant supplement for some of their patients. So this is really the goal, and with that goal, next slide, we conducted a clinical trial on antioxidants. This is the trial that we conducted very recently and published in a very high impact peer-reviewed journal. So let's dive into it. Next slide, please. If you look at the composition of this supplement, this is a study where we used Fairhaven Health Pro for men, and this is a subsidiary of our current company that we are attending this program. It is a comprehensive supplement which was chosen. It has ingredients and dosages most documented in antioxidant clinical studies. It is made by an FDA regulated GMP certified lab, and it is really tested very well to ensure the quality and consistency. So it is extremely important for the physicians to note that not all antioxidants are the same. It is not at all the same. When you are selecting a micronutrient compound for antioxidants, several major considerations should be taken. Evidence-based formulation: choose a compound that has been extensively studied and shown to have positive effects on semen parameters and fertility outcome in well-designed clinical trials or meta-analysis. Balanced combination: look for a supplement that combines multiple antioxidants, as different antioxidants may have synergistic effect in combating the oxidative stress and protecting the sperm health. And then further, dosage and bioavailability. Consider the recommended dosage and bioavailability of the micronutrient, as it is important to choose a formulation that offers an appropriate dosage to achieve therapeutic effect and has good absorption and bioavailability to ensure optimal efficacy. Next slide. So furthermore, when you are looking at the antioxidant, it is also important to know the safety and tolerability. Ensure that the compound has a good safety profile and minimal risk of adverse effect. It should be well tolerated by patient without causing significant side effects or interaction with other medication. Quality is important. Select the supplement from reputable manufacturer or brands that adhere to good manufacturing practice. So these are some of my advice when people ask which antioxidant. Next slide. But look at the results. This is just a small part of the results. This is the group of patients who were given the antioxidant for 3 months, and then the two bars that you see for concentration motility and progressive motility are before and after, and you can see there is a humongous increase in the improvement that we see, almost 147% in the category of progressive sperm motility, which is the most important parameter which defines the healthiest sperm, because they move in a straight line movement, and it is important for both natural conception as well as for in vitro fertilization related procedure. So furthermore, the results that I am not showing here, there is a significant improvement in normal sperm morphology, significant reduction in oxidative stress, and significant decrease in sperm DNA damage after 3 months of taking this type of antioxidant in patients with idiopathic infertility with a condition called MOSI, or male oxidative stress infertility. 95% of the patients have high oxidative stress in this group of patients. Not only they have abnormal semen quality. Now we further went to conduct a more advanced study to look at what are the proteins, or what is the molecular mechanism which is dictating this improvement in the semen quality, which is expressed as improvement in sperm count, improvement in sperm motility, or other parameters that we see. How is that facilitated? What is the molecular changes that are really accentuating it, expressing these changes to happen? Because nobody has ever been able to show the molecular mechanism of antioxidant use. This was the first study in the entire world where we used these antioxidants, conducted the proteomic analysis, which is really an advanced type of study, where we look at the specific proteins which are targeted. And here I show you, next slide, is the results of our study. In a snapshot, there are 3 important proteins which are the building blocks of the cell. And these are very important proteins because one of them, for example, NDO5, is responsible for oxidative phosphorylation. So it controls the oxidative stress machinery. The CCT3 is responsible for sperm binding, and picaria-1 is responsible for sperm motility. And you can see the expression of these proteins after the antioxidant supplementation was significantly increased in post-treatment group, which illustrates that antioxidants can pass through the blood-testis barrier. They can go through the testis, and then enter into the cell to improve the various important proteins which really trigger an improvement at the microscopic level that we see in improvement in sperm count, improvement in sperm motility, sperm binding, and reduction in oxidative stress. This is the most important concrete evidence of the scientific efficacy of the use of antioxidant for the first time in the whole world. Next slide. We conducted a meta-analysis. This is the results of the meta-analysis which has been published last year. One of the largest meta-analysis which looked at almost all the randomized controlled trials that have been conducted on antioxidant around the world. We selected only the most well done randomized controlled trial. And then we looked at the aggregate results using a meta-analysis approach. And we can show that the results from this particular study, which is being published in a peer-reviewed journal, that there is a significant improvement of when the antioxidants were given, the clinical pregnancy rate increased significantly as compared to the placebo treatment. So this is based on all different antioxidants in studies being conducted from all different investigators around the world. But the most common denominator is that they were all randomized controlled trial. Now, looking at, so this is very important. Next slide, please. We also saw there is a significant improvement in all the important sperm parameters. For example, there was a significant improvement in progressive sperm motility based on all the randomized controlled trial which were included in this meta-analysis. Next slide. We also saw a significant improvement in total sperm motility, which is proven. And next slide. And we also saw a significant increase in antioxidant level, the endogenous antioxidants in the semen, but also there is a significant reduction in the level of oxidative oxidants, which is measured by melanoldehyde level or MDA level. Next slide. So in terms of our recommendations on the use of antioxidants, this depends on individual patient characteristic and needs. However, we can make some general consideration to recommend antioxidant supplement in certain patients include patients with known oxidative stress, individuals with condition associated with increased oxidative stress, such as varicocele infection, exposure to environmental toxins, or lifestyle factors, smoking, excessive alcohol consumption. These patients will benefit from antioxidant supplementation. Further, patients with poor semen parameters, such as low count, sperm motility, poor sperm motility, abnormal sperm morphology. They will also benefit from antioxidant. Furthermore, patient undergoing any kind of assisted reproductive techniques such as IUI or in vitro fertilization will also improve in terms of their success rate if they are being on antioxidant. Next slide. So coming to last few slides of my presentation, male infertility is really a complicated condition with various underlying causes, including impaired sperm quality, low sperm count, genetic abnormalities that you heard, and so many more. And treating male infertility really requires addressing the specific cause, and in some cases, the underlying issue may be more challenging to overcome compared to female infertility. So really understanding the actual physiology of male reproductive system, understanding the causes of male infertility, understanding the problems of idiopathic male infertility will allow you to really understand the problems that are really seen in couples which are not really not being helped by IVF and ICSI, which are really being done throughout without much success in many of these patients. So if we look at these patients more carefully, next slide, please. I think there are opportunities for antioxidants to be helpful. So we believe that patients who will benefit repeated IUI or IVF failures, patients who have clinical grade varicocele, patients who are in older age, not 90 or 80, but patients we call as over the ages of 40, history of genital tract infection, patient with the history of smoking, idiopathic infertility, recurrent spontaneous abortion. So many of these conditions are really the key where we believe that antioxidants will play an important role. So antioxidant administration is really beneficial in men with underlying condition associated with increased oxidative stress, and that is where it has the maximum benefit. Overall, antioxidant administration really plays a significant role in optimizing male fertility potential by reducing the oxidative stress, improving the sperm parameter, and increasing the chances of achieving a successful pregnancy. Thank you very much.
Okay, thanks, Dr. Agarwal. Just to wrap up the conference, and as I mentioned, the slide deck is available to you. I'll just take two or 3 minutes just to share with you some slides that you can take a look at later so that we still have some time for some questions and answers. What you'll see in the deck basically is a clinical algorithm that will allow you to work through kind of a decision tree, if you will, looking at the fertility continuum and reproductive success, and then what are the issues and the critical questions to ask, and then be able to take that information and combine it with an appropriate and most effective nutritional therapy program. Again, the issues that we look at are the stages and segments in particular, and that's what the clinical algorithm is designed to support. You'll also see, based off of where the couple may be in their journey to conceive, whether that's planning or to the point where it's taken a little bit longer than they had hoped for, there's part of the decision tree that can identify key nutrients that can play an important role depending on what the specific issue is. I do think it's worth pointing out that particularly in the planning phase, and particularly because of the environmental stressors that are having such a major impact, it's worth considering a cleanse program for those couples that are just beginning to think about and do the early planning for that. And because that's such a big issue, the environmental stressors, it's worth considering how to integrate that into a nutrition therapy program. The decision tree and algorithm and clinical decision is available for both males and females, and that's available in this deck. And then there's a little bit more detailed information with references that'll talk about some of the most critical and most essential nutrients that are really important for both male and female fertility. So for example, folate plays an important role for both couples. So does the compound myo-inositol, particularly in helping to support endocrine balance and response, is really quite an important issue to address, which would also include and cover those women who may be experiencing PCOS. And so there's this breakdown of information that I hope that you'll find helpful in selecting and determining what nutrients may make the most sense to manage the specific issues of the patients that you're seeing. The same is true with omega-3 fatty acid. I think we all are familiar with omega-3 and the importance that it has, particularly with DHA in growth and development, but it also has a very specific benefit in also in the health and viability of the sperm and the egg, as well as the embryo. Here's a list, a short list that Dr. Agarwal had already gone over, but both ingredient selection and what's really important is clinical dosing is really critical into selecting the appropriate product and or ingredient. And so we would encourage you not only to look at what the optimal nutrients could be, but also make sure that it's the appropriate dose to elicit the improved outcomes that have been demonstrated in the clinical study. It's really an important consideration. So in summary, fertility can be affected by a number of influential issues, and we consider fertility a symptom. We understand now, or have a better understanding of the underlying issues of the systems. Fertility as a continuum includes stages and segments, and it's all coming together where both the ability to conceive, but also to make sure that the health trajectory of your baby is as optimal as it can be. Understanding these reproductive stressors, whether they're environmental stressors or a stressful lifestyle and inability to be resilient, like not having restorative sleep, are important considerations that should be addressed and managed. Oxidation is, or antioxidation is really an important issue for sperm viability, especially because the increased susceptibility that the sperm plays in the issue of infertility. The HPA-axis, or more specifically, the ability to balance cortisol, plays an important central role of a neuroendocrine communication that influences the reproductive health of both couples. With that, let me thank you for the privilege of your time in joining us. And I think we have at least 3 or 4 minutes, Amy, to answer any questions that any of you might have. We lost Amy.
I can run through some of the questions if you like.
Oh, great.
Yes. So what is the best way to preserve fertility in a healthy woman with a regular menstrual cycle that has not tried to conceive because she's not found a partner yet? But is CoQ10 helpful, and is there any science to back that?
Yeah, Ashley, do you want to take the question? Or?
Really, I mean, in terms of the healthy woman, I have not much of data myself, so this isn't my area of expertise. I'm more on the male side than on the female.
Yeah, so let me try to answer that. I think there are what I would describe as essential nutrients that are particularly important for reproductive health and for pregnant women. And some of those essential nutrients would be choline, omega-3 DHA, the antioxidants that Dr. Agarwal talked about, depending on the metabolic profile of the individual who still may be considered healthy, but depending on the metabolic profile, it's worth considering myo-inositol and frankly even CoQ10. Myo-inositol should be used at 2,000 or a little bit higher dose of 2,500 milligrams if you're selecting myo-inositol. And CoQ10, there's great science around CoQ10 and the viability and the health profile of reproductive hormones and function, but that's at levels of a clinical threshold of efficacy of 100 milligrams or higher.
Thank you. What would you deem the most comprehensive cutting-edge fertility test for male and females who are looking to conceive?
I can take a jab on the male side. In terms of the male, I think besides the routine tests that are already there and well known, such as semen analysis, there are several newer tests which have been introduced. Some of them are actually using the AI or artificial intelligence, both in terms of just simple semen analysis. The platform which employs AI really makes it very, very attractive, because the actual tests become very fast, highly accurate, and very precise, and something that has really changed in the last 4 or 5 years, because routine semen analysis examination is the most important part of all male infertility workup. But besides that, more advanced tests for sperm DNA fragmentation, which have again become very, very popular and important for patients where routine semen analysis isn't able to tell us all the things that are going on, and we need to look further into the molecular causes of infertility at the functional level. So the test for sperm DNA fragmentation, test for oxidative stress are some more recent tests which are already adopted and are available for diagnostic purposes to infertile couples. There are many other esoteric tests, but they have not really become popular and are not offered routinely. So I'm talking about only the tests which are really recommended by the World Health Organization, as well as those which are no longer considered as the research test and are only could be done by a few labs in the country, but tests which are really commonly done. So those are some of the most important developments that have happened over the last 5-6 years that I think are really changing the landscape of male infertility diagnostics.
Thanks, Dr. Agarwal. I saw that Amy joined us, so that must mean the big hook is out. So as a last invitation, I'd like to invite all of you to join our Summit for Women's Health, being sponsored by FullScript, on Wednesday, September 17th at 1 o'clock. We're excited to have our CEO of Blue Root Health, Jane Pemberton, and other industry leaders join us, including Dr. Tirana Lodog and Dr. Aviva Ram, as well as a number of other experts that will be joining that discussion. It'll be a broad discussion on the importance of women's health and the role of nutrition in particular. A brand new FullScript supplement protocol will be provided that'll support patients with nutrient deficiency, and oral contraceptive pills will be announced. And so that should be pretty exciting. Will be provided to all the participants and attendees. So you'll gain, if you join us, you'll gain access to really very helpful tools that give you action-oriented recommendations and insights that'll really help manage the issues that many of your patients, both male and female, will often be facing. So with that, thank you. And Amy, back to you for any last house cleaning items. Or,
can you hear me?
Yes.
Sorry about that, everyone. I just ran into a little technical right at the end. There we go. Okay, if everyone can hear me. I just want to say thank you so much to everybody for their time today. And thank you so much, Donna, for the little assist while I jumped off momentarily. We really enjoyed the presentation. And this is my favorite part, just kind of any sort of wrapping up thoughts that we're thinking as we're thinking about this topic at large. Dr. Ashtuk or Dr. Troop, if you kind of want to wrap it up with a little bit of final thoughts, that would be great.
Go ahead.
Okay, John, go ahead.
No, you please.
Well, just in a nutshell, thank you very much, first of all, to our host, FullScript and Emerson, and to John for putting this all together. I believe the problems of male infertility are in front of us, and we can do either two things. Either we can bury our head in the sand and just ignore all the problems and just let the woman be the fall guy and take the burden of pregnancy and childbirth, but also all the treatments that go with it. Or we can really try to learn more about the problems of male infertility and how nutrition and antioxidant and many other types of new things that can help alleviate these problems and make it possible for a large number of men who are really completely frustrated and have nothing to look forward to find that they can become parents. And I believe that it is completely possible, and something that is achievable. We are already seeing that. And I would like to really convey this positive message to all of you.
And let me just say thanks everybody for, again, giving us the privilege of your time and joining us for this great discussion. Thank you.
Excellent. Thank you to everyone who attended today. And everyone look out in their email for a link to view this recording, as well as a special offer from Fairhaven Health and more information about the upcoming FullScript Women's Health Summit on September 27th. To anyone who has any additional questions, you can email them to me at amy.regan, R-E-G-A-N, @fullscript.com, and I'll help get those answered. And I hope everyone enjoyed this presentation and has a great rest of your day. Thank you so much, everybody.